Arthritis causes, types and treatment. The word arthritis is used to describe pain, swelling, and stiffness in a joint or joints. Arthritis isn't a single condition and there are several different types. The most common form of arthritis is osteoarthritis. Other common rheumatic conditions related to arthritis include gout, fibromyalgia, and rheumatoid arthritis, RA. Rheumatic conditions tend to involve pain, aching, stiffness, and swelling in and around one or more joints. The symptoms can develop gradually or suddenly. Certain rheumatic conditions can also involve the immune system and various internal organs of the body. Some forms of arthritis, such as rheumatoid arthritis and lupus, SLE, can affect multiple organs and cause widespread symptoms. According to the Centers for Disease Control and Prevention, CDC, 54.4 million adults in the United States have received a diagnosis of some form of arthritis. Of these, 23.7 million people have their activity curtailed in some way by their condition. Around 10 million people in the UK are thought to have arthritis. It can affect people of all ages, even children and teenagers. Arthritis is more common among adults aged 65 years or older. Main types. Because there are several types of arthritis, it's important to know which one you have. There are some similarities between these conditions, but there are also some key differences. Osteoarthritis. The most common type of arthritis is osteoarthritis. It is estimated that around 8.75 million people in the UK have seen a doctor about osteoarthritis. Osteoarthritis starts with the roughening of cartilage. If this happens, the body can put in place a repair process to try to make up for the loss of this important substance. The following can then happen. Tiny bits of extra bone, called osteophytes, can grow at the ends of a bone within a joint. There can be an increase in the amount of thick fluid inside the joint. The joint capsule can stretch, and the joint may lose its shape. Sometimes, the early stages of osteoarthritis can happen without causing much pain or trouble. However, it can lead to damage inside a joint, as well as pain and stiffness. Osteoarthritis is more common in women and usually affects people from the age of 45 onwards. The parts of the body most commonly affected are the knees, hands, hips, and back. Keeping active will help you maintain a healthy weight, and this will reduce the pressure on your joints. Doing regular exercise will keep muscles around a joint strong, and this will help to support and stabilize a joint affected by osteoarthritis. Being overweight can make you more likely to get osteoarthritis and can make it worse. Taking painkillers, such as paracetamol and non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can help reduce your symptoms and allow you to stay active. Keeping active will also reduce pain, stiffness, and swelling. There are NSAID creams that you can rub into the affected area. It might be an idea to try these first. There is a range of pain relief options available. If you're finding the pain of osteoarthritis difficult to cope with, a doctor or physiotherapist would be able to give you specific advice. If your osteoarthritis becomes severe, particularly in your knees and hips, your doctor might discuss with you the possibility of surgery. This is usually considered only after you've tried all the other treatment options. Joint replacements are now very sophisticated and successful. Gout and calcium crystal diseases. Gout is a type of inflammatory arthritis that can cause painful swelling in joints. It typically affects the big toe, but it can also affect other joints in the body. Joints affected by gout can become red and hot. The skin may also look shiny and can peel. It's caused by having too much urate, otherwise known as uric acid, in the body. We all have a certain amount of urate in our body. However, being overweight or eating and drinking too much of certain types of food and alcoholic drinks can cause some people to have more urate in their bodies. The genes you inherit can make you more likely to develop gout. If it reaches a high level, urate can form into crystals that remain in and around the joint. They can be there for a while without causing any problems and even without the person realizing they are there. A knock to a part of the body or having a fever can lead to the crystals falling into the soft part of the joint. This will cause pain and swelling. There are drugs that can reduce the amount of urate in the body and prevent gout attacks. Examples are allopurinol and febuxostat. If you're having a gout attack, you'll also need short-term pain relief. Non-steroidal anti-inflammatory drugs, NSAIDs, as well as paracetamol, can be good drugs to try first. Men can get gout from their mid-20s, and in women, it's more common after menopause. Taking water tablets can increase the risk of gout. There are also conditions that cause calcium crystals to form in and around joints. We all need calcium to make bones and teeth strong. However, some people can have too much calcium in their bodies, which can then form as crystals around joints. This can lead to painful swelling. Calcium crystal diseases tend to clear up on their own. Taking painkillers and NSAIDs, and applying an ice pack wrapped in a damp towel, can soothe the pain and swelling. Rheumatoid arthritis. Rheumatoid arthritis is a type of inflammatory arthritis. It is what is known as an autoimmune condition. The immune system is the body's natural self-defense system, and it protects us from infections and illness. When someone has an autoimmune condition, the body's immune system mistakenly attacks the body's healthy tissues, such as the joints, causing inflammation. Inflammation is normally an important tool in the immune system. It occurs when the body sends extra blood and fluid to an area to fight infection. This is what is happening, for example, if you have a cut that gets infected, and the skin around it becomes swollen and a different color. However, in rheumatoid arthritis, the inflammation and extra fluid in a joint can cause the following problems. It can make moving the joint difficult and painful. Chemicals in the fluid can damage the bone and joint. The extra fluid can stretch the joint capsule. Whenever a joint capsule is stretched, it never quite returns to its original position. Chemicals in the fluid can irritate nerve endings, which can be painful. As well as causing pain and stiffness, inflammation can cause permanent damage to a joint. Starting effective treatment early on can help to minimize damage. Symptoms of rheumatoid arthritis can include swollen and tender joints, swelling and stiffness in joints in the morning that lasts for longer than half an hour, severe tiredness, also called fatigue, a general feeling of being unwell. Rheumatoid arthritis often starts in the small joints of the hands and feet, and it can affect the same joints on both sides of the body at the same time. It can start quite slowly and then gradually get worse, or it can start more aggressively. Rheumatoid arthritis can affect adults of any age. It most commonly starts among people between the ages of 40 and 60. It's more common in women than men. There are drugs that can slow down an overactive immune system and therefore reduce the pain and swelling in joints. These are called disease-modifying anti-rheumatic drugs, DMARDs, and include biological therapies. If you have rheumatoid arthritis, treatment will start with conventional DMARDs. These can have the overall effect of reducing the activity of your immune system, which is overactive and causing damage to your body. If these drugs have been tried and don't work, doctors will look at the possibility of trying the newer biological therapies. Biological therapies have a more targeted effect on the immune system. Spondyloarthritis. Spondyloarthritis is a word used to describe a number of conditions that cause pain and swelling, mainly around the joints of the spine. In these conditions, there is inflammation of small pieces of connective tissues, called entheses. These are tough little cords that join either ligaments or tendons to bones. Ankylosing spondylitis. Ankylosing spondylitis is a type of spondyloarthritis, and it causes pain and swelling, mainly around the joints of the spine. In this condition, in response to inflammation around the spine, the body can create more of the mineral calcium. This mineral is normally used by the body to make bones strong. However, in ankylosing spondylitis, the extra calcium can make new bits of bone grow in the spine, and this will cause pain and stiffness. This condition typically causes pain in the second half of the night and swelling of your back in the morning that lasts for more than half an hour. There are drugs that can slow this process down. Keeping active will help to minimize stiffening of the spine, while maintaining a good posture will help prevent increased curving of the spine. Ankylosing spondylitis usually occurs between the ages of 20 and 30. It is more common among men. Psoriatic arthritis. Psoriatic arthritis is an autoimmune condition. It is also a type of spondyloarthritis. The body's immune system can cause painful swelling and stiffness within and around joints, as well as a red scaly skin rash called psoriasis. The rash can affect several places in the body, including the elbows, knees, back, buttocks, and scalp. It is also common to have severe tiredness, otherwise known as fatigue. Disease-modifying anti-rheumatic drugs, DMARDs, and biological therapies can treat the cause of the inflammation in joints. There is also a variety of treatments, such as creams and medications, for psoriasis. Psoriatic arthritis usually affects people who already have psoriasis. However, some people develop arthritis before psoriasis. It's possible to have arthritis but no psoriasis at all. This condition can affect people of any age but tends to affect adults. Juvenile idiopathic arthritis, JA. If someone is diagnosed with inflammatory arthritis before their 16th birthday, it's called juvenile idiopathic arthritis, or JA. There are different types of JA. They are autoimmune conditions, and the immune system can cause pain and swelling in joints. The earlier someone is diagnosed with JA, the better. This is so that effective treatment can be started and limit any damage to the body. There are drugs that can treat the symptoms, such as painkillers and non-steroidal anti-inflammatory drugs, NSAIDs. Disease-modifying anti-rheumatic drugs, DMARDs, and biological therapies can slow down or stop arthritis causing the swelling inside the body. There are about 12,000 young people in the UK who have JA. Early signs of arthritis. They can develop gradually or suddenly. As arthritis is most often a chronic disease, symptoms may come and go, or persist over time. However, anyone who experiences any of the following 4 key warning signs should see a doctor. Pain. Pain from arthritis can be constant, or it may come and go. It may affect only one part, or be felt in many parts of the body. Swelling. In some types of arthritis, the skin over the affected joint becomes red and swollen and feels warm to the touch. Stiffness. Stiffness is a typical symptom. With some types, this is most likely upon waking up in the morning, after sitting at a desk, or after sitting in a car for a long time. With other types, stiffness may occur after exercise, or it may be persistent. Difficulty moving a joint. If moving a joint or getting up from a chair is hard or painful, this could indicate arthritis or another joint problem. Natural remedies. A healthful, balanced diet with appropriate exercise, avoiding smoking, and not drinking excess alcohol can help people with arthritis maintain their overall health. Diet. There is no specific diet that treats arthritis, but some types of food may help reduce inflammation. The following foods, found in a Mediterranean diet, can provide many nutrients that are good for joint health. Fish, nuts and seeds, fruits and vegetables, beans, olive oil, whole grains. Foods to avoid. There are some foods that people with arthritis may want to avoid. Nightshade vegetables, such as tomatoes, contain a chemical called solanine that some studies have linked with arthritis pain. Research findings are mixed when it comes to these vegetables, but some people have reported a reduction in arthritis symptoms when avoiding nightshade vegetables. Self-management. Self-management of arthritis symptoms is also important. Key strategies include staying physically active, achieving and maintaining a healthy weight, getting regular checkups with the doctor, protecting joints from unnecessary stress. 7 habits that can help a person with arthritis to manage their condition are: being organized. Keep track of symptoms, pain levels, medications, and possible side effects for consultations with your doctor. Managing pain and fatigue. A medication regimen can be combined with non-medical pain management. Learning to manage fatigue is key to living comfortably with arthritis. Staying active. Exercise is beneficial for managing arthritis and overall health. Balancing activity with rest. In addition to remaining active, rest is equally important when your disease is active. Eating a healthful diet. A balanced diet can help you achieve a healthy weight and control inflammation. Avoid refined, processed foods and pro-inflammatory animal-derived foods and choose whole plant foods that are high in antioxidants and that have anti-inflammatory properties. Improving sleep. Poor sleep can aggravate arthritis pain and fatigue. Take steps to improve sleep hygiene so you find it easier to fall asleep and stay asleep. Avoid caffeine and strenuous exercise in the evenings and restrict screen time just before sleeping. Caring for joints. Tips for protecting joints include using the stronger, larger joints as levers when opening doors, using several joints to spread the weight of an object such as using a backpack, and gripping as loosely as possible by using padded handles. Do not sit in the same position for long periods. Take regular breaks to keep mobile. Physical therapies. Doctors will often recommend a course of physical therapy to help patients with arthritis overcome some of the challenges and to reduce limitations on mobility. Forms of physical therapy that may be recommended include warm water therapy. Exercises in a warm water pool. The water supports weight and puts less pressure on the muscles and joints. Physical therapy. Specific exercises tailored to the condition and individual needs, sometimes combined with pain-relieving treatments such as ice or hot packs and massage. Occupational therapy. Practical advice on managing everyday tasks, choosing specialized aids and equipment, protecting the joints from further damage and managing fatigue. Physical activity. Research suggests that although individuals with arthritis may experience short-term increases in pain when first beginning exercise, continued physical activity can be an effective way to reduce symptoms long-term. People with arthritis can participate in joint-friendly physical activity on their own or with friends. As many people with arthritis have another condition, such as heart disease, it is important to choose appropriate activities. Joint-friendly physical activities that are appropriate for adults with arthritis and heart disease include walking, swimming, cycling. A healthcare professional can help you find ways to live a healthful lifestyle and have a better quality of life. Natural therapies. A number of natural remedies have been suggested for different types of arthritis. According to the Organisation vs. Arthritis, based in the United Kingdom, UK, some research has supported the use of devil's claw, rosehip, and boswellia from the frankincense tree. Devil's claw and boswellia supplements can be purchased online. There is some evidence that turmeric may help, but more studies are needed to confirm their effectiveness. Various other herbs and spices have been recommended for raw, but again, more research is needed. They include turmeric, garlic, ginger, black pepper, and green tea. Many of these herbs and spices are available to purchase online in supplement form, including turmeric, ginger, and garlic. Anyone who is considering using natural remedies for any type of arthritis should speak to a doctor first. Causes of arthritis. There is no single cause of all types of arthritis. The cause or causes vary according to the type or form of arthritis. Possible causes may include injury, leading to degenerative arthritis; abnormal metabolism, leading to gout and pseudo-gout; inheritance, such as in osteoarthritis; infections, such as in the arthritis of Lyme disease. Things to consider. Diet and nutrition can play a role in managing arthritis and the risk of arthritis, although specific foods, food sensitivities, or intolerances are not known to cause arthritis. Foods that increase inflammation, particularly animal-derived foods and diets high in refined sugar, can make symptoms worse, as can eating foods that provoke an immune system response. Gout is one type of arthritis that is closely linked to diet, as it is caused by elevated levels of uric acid, which can be a result of a diet high in purines. Diets that contain high purine foods, such as seafood, red wine, and meats, can trigger a gout flare-up. Vegetables and other plant foods that contain high levels of purines do not appear to exacerbate gout symptoms, however. Risk factors for arthritis. Certain risk factors have been associated with arthritis. Some of these are modifiable while others are not. Non-modifiable arthritis risk factors. Age. The risk of developing most types of arthritis increases with age. Sex. Most types of arthritis are more common in females, and 60% of all people with arthritis are female. Gout is more common in males than females. Genetic factors. Specific genes are associated with a higher risk of certain types of arthritis, such as rheumatoid arthritis, RA, systemic lupus erythematosus, SLE, and ankylosing spondylitis. Modifiable arthritis risk factors. Overweight and obesity. Excess weight can contribute to both the onset and progression of knee osteoarthritis. Joint injuries. Damage to a joint can contribute to the development of osteoarthritis in that joint. Infection. Many microbial agents can infect joints and trigger the development of various forms of arthritis. Occupation. Certain occupations that involve repetitive knee bending and squatting are associated with osteoarthritis of the knee. Comorbidities. Check in the description below on how to treat arthritis. Kindly like, share and comment on our channel. Don't forget to subscribe to be one of the first to get new content. Thank you.